你把手机给我一下。Live。
Live ready, is it? Okay, so hi, good evening, everybody. Sorry. Hi, good evening, everybody. A very well welcome to all of you for joining our Facebook Live session in this lovely evening. Before we proceed, I would like to introduce myself. My name is Yap from Bagan Specialist Centre marketing team, and I will be your host for today's program. Today, I'm glad to invite Dr. Anil Krishna of Bagan Specialist Centre to give us a sharing on this evening. In this hour, Dr. Anil will share topic of antenatal care. Dr. Anil is an obstetrician, gynecologist, and urogynecologist in Bagan Specialist Centre. If you have any question to ask our doctor, please feel free to raise the question in FB post column. To kick off this program, please allow me to welcome Dr. Anil. Over to you, Dr. Anil.
Hi, thank you very much. Hi, good evening. I'm Dr. Anil. I'm a consultant obstetrician, gynecologist, and urogynecologist at the Bagan Specialist Centre. And today, I will be talking about antenatal care. Okay. Okay, some technical issue here. Just settle this and we'll start. Okay, so my topic for this evening is antenatal care. Antenatal care is something very important, especially for pregnant ladies. Okay, I will start. Once your menses is missed or delayed, if you have regular cycles, once it's missed or delayed, the first thing, and if you start having some funny symptoms, first thing you should do is to check your urine pregnancy test. Okay, so you can get the urine pregnancy test from everywhere, from the pharmacy and all that. And once you see 2 lines, okay, don't panic, yeah, don't panic, just keep calm. Look for an obstetrician or look to confirm about the pregnancy. So what is antenatal care? Antenatal care is a systemic supervision of women during pregnancy. That means there are a lot of factors to make sure that the woman, a lady is well during her pregnancy. So the main objective is to ensure a normal pregnancy with delivery of a healthy baby from a healthy mother. Basically, healthy mother, healthy baby. The aim of antenatal care is to prevent, to detect, and to treat complications if there are any complications at the earliest time as possible. Okay, before the things can get worse, we try to detect and solve the problems. I will be discussing about a few complications which may occur, common complications. There are many complications, many things can happen, but we just talk about the common ones. So, and antenatal care, during antenatal care also we take advantage to educate mother about pregnancy and also labor. So first of all, pregnancy is divided into 3 time zones, or we call it trimesters. So first trimester is from the time you're pregnant until 12 weeks, basically up to 4 months. Then the second trimester, okay, you can see first trimester. First trimester is very important. That is the main part where the baby grows, the organs grow, okay, organs form, baby forms and organs form. And until 12 weeks, you can see the baby, it looks like a baby already. You can see the head, eyes, the hands and all that. Then second trimester is from 13 weeks to 28 weeks. Okay, is from here onwards is just the baby just starts growing bigger. And the final trimester, third trimester, is from 29 weeks until delivery. At this phase, the baby grows very fast. Every week grows gets bigger until delivery. So first of all, once you miss your period, how we diagnose, how we confirm you're pregnant? The first is the urine pregnancy test. Okay, once you get 2 lines, that means confirm pregnant. After that, what you should do is come for an ultrasound scan. Ultrasound scan is to look to make sure that the pregnancy is inside the uterus. Okay, so when you do ultrasound, basically you will see a sac inside the uterus, and this one is actually a baby which is about 10 week size lah, 10 to 12 week size. But basically initially early pregnancy, you will see a sac inside the uterus. If we don't see a sac inside the uterus, what we are worried about is ectopic pregnancy, which I'll talk about. And if any suspicion, we will do a blood investigation, which is the beta HCG level. Beta HCG is the hormone of pregnancy. So from this level, we can estimate if from the level we can see whether the sac, whether the pregnancy can be seen inside the uterus by ultrasound. Okay, if the level is still low, that means it's still early pregnancy. The dates may be wrong, so we might not be able to see the sac. So what we do is we repeat after 48 hours, or we repeat the scan after like 2 or 3 days to make sure it is inside the uterus. So when we see something like this, okay, this one is a scan. This one is a transvaginal scan actually. We scan from down and the uterus is empty, no sac. In cases like this, once if the urine pregnancy test is positive, we do a beta HCG. But this one good part, you don't see any fluid outside the uterus, so it is still safe. Then once you're confirmed pregnant, next thing is booking. Booking is the first antenatal check. Okay, so the first antenatal check, what we do is during this first check, we take a detailed history. Okay, first of all, we ask you your first day of the last menstrual period. Okay, this is very, very important. Ladies, please always remember this date. Whenever you get your menses, we always want to know the first day of the last menstrual period. Okay, sometimes if the ladies forget, we ask the husband. 30% of the ladies forget this date, so we ask the husband, and husband will tell accurately, but please remember this date. And then we ask you for symptoms like any vomiting, any breast pain, and symptoms of pregnancy. And then we take a detailed medical history. If you have any medical problem, like any asthma, or you're having any suffering from any blood problem, or any other medical problem, or you're taking any medication which may affect the pregnancy, or medical problem which may affect the pregnancy. And after medical problem, we ask for surgical problem, if you had any operation done before. And then drug allergies, if you're allergic to any medication like antibiotics or painkillers, which we may use during the pregnancy to treat certain problems. Okay, after all this, we ask details about previous pregnancy. If your first pregnancy, this one we will not ask, but if you had previous pregnancies, we will ask about previous pregnancies, any complications, how you delivered, any complications during the delivery, and things like that. So if you have the red book, it's good to bring along. We can see all the details inside there. After that, we ask about family history. Okay, any family history or medical conditions or diabetes which may which you may have also and affect the pregnancy. So this is a very important book. This is the Ministry of Health Red Book. All the details are here. Okay, as you can see, LMP, EDD, and then all the details. Pregnancy, how many we can, from here we can tell how many deliveries you had, how many pregnancies you had, any problems, and all that is here. Okay. After that, what we do is we examine. We do a general examination. We check the heart, we check the lungs, we palpate, we check the abdomen, we see whether we can feel the uterus or not, we see any other organs enlarged. And then we do an ultrasound scan. Ultrasound scan to confirm whether it is a baby inside the uterus or not. And if the baby inside the uterus, we scan to see the size to confirm whether the dates are correct. And proceed with blood investigations. Okay, blood investigations, we do full blood count. That one is to see your hemoglobin, see whether you're enough blood, not enough red blood cells. Blood group and RH. We also find out what is your blood group. RH is very important. If it's negative blood group, then we need to give certain treatment later. And also we routinely do all the infection studies, the HIV, VDRL, hepatitis B. And after all this, we advise you for supplements. During the first trimester, usually I only give folic acid, which is very, very important. And if you are booked later, maybe in the second trimester, then I will supplement with iron, calcium, iron, vitamin C, calcium. So antenatal care is basically a scheduled visit. Basically, the first up to the first 28 weeks, first and second trimester, we see a lady monthly, and then after 28 weeks, maybe we schedule 2 to 3 weekly, all up to about 36 weeks. And after 36 weeks, we schedule the visits weekly until delivery. But this also depends on how healthy the mother is, mother and baby are. Okay, if the mother and baby are very healthy, everything is well, maybe the schedules, the visits will be a bit longer. But if there is problem, we may see a bit more frequently. So during the antenatal visit, what do we do? At each visit, we ask for symptoms. If you have any symptoms like any vomiting, any pain, any discharge, any bleeding, any problem with passing urine, passing motion, all these kind of things. And if after 20 weeks, we'll ask about baby movement. Okay, see if your baby is moving well or not. And if you have any complaints also, please, or if you have any query also, please ask us. Okay, this is the best time. When you see us, you can ask if you have any pain or anything you can take or cannot take or anything, you can ask us. And after that, we routinely examine the blood pressure, the weight, we monitor the weight gain, and also we check if there's any leg swelling. This is part of the examination. After that, we will check the abdomen to see the uterus size. Okay, and then we look for we listen to the baby's heartbeat, see if it's good and strong or not. And also we check if the baby, once after third trimester, we check the baby's position, see if the baby is in the required position. And like if you follow up with usually what we do is we do ultrasound. We routinely do ultrasound. Okay, in private centers, at each visit we do ultrasound. We check for the size, we check for the growth, and we check for the position. And another important test which is done every visit is the urine and the urine for sugar and protein. So this is to monitor if for diabetes and to monitor if you have any infection or any high blood pressure complications. And my routine, okay, I don't know about others. Once you are 37 weeks above, what I do is I will do a vaginal examination, because once you get to the time, you know, a lot of people ask, when am I going to deliver? When am I going to deliver? The only way to know is to do a vaginal examination and see the cervix. Okay, from there we can somehow estimate. Okay, this is my my routine. So I will go to the first trimester. Okay, what are the possible things that can happen? What will you experience, or what are the complications may occur? Okay, as you can see, this is the picture here is a growth from 20 days to 12 weeks of the baby inside, or the fetus. This is a 5D scan. This is a 5D scan image, 5D scan image of a baby which is about 7 weeks old. Okay, 5D, you can see clearly it's like this. So first trimester, usually what we expect is sometimes there will be bleeding, vomiting is very common, and also we also take the opportunity to screen for any abnormality. So scan in the first trimester is very important. The first thing is to confirm the pregnancy inside the uterus. The second thing is to confirm the date. We scan and measure the baby inside and make sure it is same as your last menstrual period. Okay, if it is not the same, then we will revise this is to find out the due date. If it's not the same, we will have to revise the due date. And then another thing is, okay, you can see this is the image of a uterus with a sac inside. Okay, this is the sac, and we measure the sac. This is about 5 weeks, 5 weeks plus, and you can see EDD means this the due date, estimated due date, which is about 2nd of April. So this is an old scan. Second thing is early scan. We see, if we see 2 sacs means 2 children, 2 babies inside. So from here we can clearly see the number of sacs means the number of babies you're going to expect. And then another thing is cyst, which I'll talk about in a while. Sometimes you may see cyst, which is normal during pregnancy, and also we do certain scans for screening for abnormality, especially like Down syndrome. So now bleeding. Okay, bleeding is quite common in early pregnancy. Some of the causes are, the most common cause is implantation bleed. That means when the embryo implants inside the endometrium, inside the cavity, inside the uterus, at that time there may be some bleeding. Bleeding, that means not profuse bleeding like your menses, it's like just spotting only. Few spots of fresh blood, or sometimes it's just stale blood. Sometimes there can be erosion. Erosion means just some inflammation, because due to some infection, there's raw area around the cervix, so that one can cause bleeding, or some polyps. And bad news, if there's miscarriage, if the baby is not alive, not viable, there can be some bleeding. Or if there's ectopic pregnancy, this one is with bleeding and they may have pain. Or if there's molar pregnancy. Okay. From this diagram, you can see one of the cause is cervical sensitivity. Sometimes the cervix is very sensitive. Or infection, previous discharge or some infection which cause the cervix to be raw area, or inflammation. There will be raw area, can cause bleeding. Molar pregnancy is, it is not baby, it is like grape-like structures. Okay, pregnant with grape-like structures. And the commonest is implantation bleed. This is called the endometrial cavity, and this is where the baby forms. So when the baby implants into the cavity, there can be some bleeding. So most important is the bleeding is, you must tell us how bad the bleeding is. Sometimes they come, they say bleeding, but it's only some brownish discharge. The brownish thing is just stale blood, whatever in the vagina with previous bleed. What we are worried about if you're bleeding fresh bleed, which is a lot. So miscarriage is quite common. Most of the time is unknown. Once confirmed miscarriage, usually we need to evacuate the sac or the baby. Most common cause of miscarriage is usually due to abnormal fetus. This is from studies. They checked the DNA and found there's some abnormality. But some ladies with certain medical conditions, blood disorders, or if you're taking certain medication, are prone to have this kind of problem. So if you have miscarriages, we call recurrent miscarriages. When you have 2-3 miscarriages one shot, okay, we have to do further tests, further blood investigation, scans, to make sure everything's okay. And if you have previous miscarriages, my advice is to see the doctor. Once the urine pregnancy test is positive, we can give some medications to prolong the pregnancy. Okay, so this is an image. You can see typical the baby inside, but you cannot see if real time there's no heartbeat activity and the baby is down. Okay, or you can usually what we see is a sac, empty sac, which is irregular. Okay, it is irregular. It's not. This is typical of miscarriage of scan pregnancy. Ectopic pregnancy means pregnancy outside the uterus. So as I said earlier, once we scan, we don't see the sac inside the uterus, we get worried. So we will do the test, the beta Hg. If the beta Hg is more than 1005, we should be able to see the sac. If the beta Hg says comes as 300, maybe it's just wrong dates, maybe it's just early pregnancy. So it all depends on beta Hg level, but usually ectopic, once it ruptures, once the thing bursts, once it starts bleeding, it is very painful, and you will have all the symptoms. You feel your abdomen getting like bloated, you feel like giddy, heart starts beating. These are all dangerous signs, but the pain will be the severe pain. And this is a very life-threatening condition and need urgent surgery because the bleeding is inside the abdomen, we cannot see. Okay, so this is a typical ectopic is usually in the tube, pregnancy outside the uterus. So this is the one I did recently, a lot of bleeding, and you can see this is the ovary, this is the tube, and this is actually the sac, the baby with the sac inside is outside, just at the tube. So all we have to do, we cut this, but there's a lot of bleeding. In this case, there was like about 700 mils of blood in the cavity already, in the abdomen already. Molar pregnancy, occasionally we see, quite common in this area, in our Southeast Asian area. Okay, it is pregnancy, but it is not baby. It is like grape-like structure. It is inside the uterus instead of baby. And once it's is detected, we need to evacuate. So it's like this, something like this. All like vesicles, grape-like structure. And ultrasound will show like this. We call this is like a honeycomb appearance. Okay. Commonest problem, the first 14 weeks, nausea and vomiting. Some women will not experience it, but a lot of women experience it. Commonest symptom. Actually, if the more you vomit is better, good for pregnancy, but not good for women. This is why I tell all ladies, it's good for the pregnancy, but not good for the mother. Okay, that means pregnancy is strong, but the mother will suffer. So this is the commonest problem in pregnancy. So most important is to take a lot of fluids. Okay. During early pregnancy, you don't have to worry. The body has enough nutrients to support the baby. All you need is, if you're vomiting, most important is to take fluids, water, juice, or maybe some gassy drinks, like 100 plus. Some of them, when they take some gassy drinks, when they burp, they feel relief. Or you can take even ginger ale, ginger kind of boiled ginger, ginger tea, which can help reduce. Ginger is supposed to help reduce vomiting. And solids, if you can take solids, avoid oily and spicy food. What I advise is buy the cream crackers, the square one, the ampasagi biscuit. That one very good. I always advise to take small frequent meals. Okay, don't take one shot, one gulp of water, say to 1 cup of water. Take half, small sips, but very frequently. And even food, take small bites, but frequently. So if symptoms are very severe, until like you cannot take anything, even cannot take any water, cannot take any food at all, And when you look in the mirror, you stick out your tongue, the thing is coated white. That means you're dehydrated already. In this kind of case, you need to get admitted and need for intravenous medication, IV fluids. It is quite common for some women to be admitted 2-3 times to the hospital. We have seen many times, but some of them after 1-2 times, one time they're okay. So most important is keep well hydrated, and usually these symptoms will reduce after 14 weeks. After like 3.5 months to 4 months, the symptoms will reduce. And also the strange part is sometimes the husband also can experience, when the wife is pregnant, husbands will be vomiting. Okay, so can happen. Okay. Next is screening. During pregnancy, we will early pregnancy we do some screening. Basically, screening to for Down syndrome or any other syndromes. So during the most important is, if you come and see us early, 11 to 13 weeks, we do the scan. We call it the nuchal translucency thickness scan. The one we measure. Nuchal translucency is a column of fluid behind the neck of the baby. Okay, it is just behind the neck. Okay, afterwards I'll show you a diagram. So we measure that to see the thickness. This is a screening test. It is not accurate. And along with blood tests, certain blood tests we do, it is more accurate. But okay, as you can see here, this is the baby, and basically what we measure is this part. Okay, when we measure something, when it's thin like this, when it's not, is narrow, it means it's normal. But as you can see, if it's thickened, okay, if it's like say more than 2.5 millimeter, then it is abnormal. Okay, if more than 2.5 millimeter, then we have to do further tests to confirm if the baby is abnormal or not, or any problem. So the next step is, we advise them is, maybe we do a non-invasive check. Okay, so non-invasive blood test, non-invasive chromosome check, or pre-pregnancy, the pregnancy test is, the baby's DNA is found in the mother's blood. Okay, as you can see, the baby's DNA is also found in the mother's blood. So this test, what they do, they take the mother's blood and they isolate the baby's DNA. Okay, and they isolate the baby's DNA and they study it. They will study it to see if there's any problem with the chromosome. Okay, and also in early pregnancy, we can also know the sex of the baby. So so this test is done. This is about 99% accurate. No? Okay, and if another option is, if this is so suspicious, the next one is to do amniocentesis. That one is later, usually done after 50 weeks. That one is the fluid, the fluid inside the amniotic fluid, the fluid inside the uterus. It is a certain amount of fluid sucked out. The baby's cells are isolated and the DNA is studied. This one is like 100% to be 100% sure. Okay. Cyst in pregnancy. Okay, whenever we scan, there will be a small cyst. Okay, usually the cyst is about 2 to 3 cm. This is called a corpus luteal cyst. This cyst is quite common. It is to support the pregnancy. But sometimes, occasionally we see, sometimes this cyst can be bigger, say about 4 to 5 cm. Still, you don't have to worry. If you can see something like this, just one round with black inside without any, there no other, no whitish structure or anything like that, we are quite sure it is just a simple or just a corpus luteal cyst, which may disappear. But if the cyst is big, say about 6-7 cm, sometimes 8 cm, and inside you can see funny things inside, some whitish color and things like that, this may be some other cyst. Most commonly also dermoid cyst. So if there is a cyst, there's a bigger cyst, if we need to do surgery, usually we do after 14 weeks. What we are worried about is torsion, the twisting of the cyst. Usually this occurs after delivery. Okay, it occurs after delivery of the baby. When the uterus shrink, it pulls down the ovary and it causes the thing to twist portion, but it may occur also during pregnancy. So all this depends. Cyst during pregnancy, it depends on what type of cyst, the size, and also all need further assessment, and the obstetrician will assess and advise you further. But this, if there's a small cyst, you don't have to worry. Then we go to second trimester. So the baby has grown to, it is from 13 weeks. Second trimester is from 13 weeks to 28 weeks. So second trimester, we again monitor the baby's growth. This baby is a Friday scan of 18 week size. So we monitor the baby's growth. We do detailed scan, usually done at 20 weeks. And then we screen for medical problems in pregnancy like diabetes. We look out for high blood pressure, anemia, vaginal discharge. These few things are common second trimester problems. So baby growth and detailed scan, what we do is the growth will be monitored. How we monitor the growth? One is every visit we will examine your abdomen to see the size of the uterus, whether it is corresponding to the dates or not. Okay, whether it is growing bigger or it is not growing properly, or it is smaller than the dates. Okay, when it's bigger than the dates, there are certain conditions which cause it. If it's smaller, also certain condition. But what we want to make sure it is the ideal size for that period of pregnancy. So we will measure the uterus size, the height, and if we check it corresponds to the period of pregnancy. And then we will do an ultrasound. Okay, ultrasound to see the baby's growth. Also the ultrasound measurements, we make sure it is corresponds to the dates of that period of the pregnancy. And after that, we also scan the placenta to see its location. Okay, to make sure it is at the right position. It is not in the lower part. Lower part is called placenta previa, which I will talk about later. And detailed scan is done after 20 weeks. A detailed scan is done to look at the formation of all the head, the brain, the organs, the bones. This is usually a 2D scan where we can see inside of the baby. We can look at the heart. We can look at all the organs, whether the heart is formed properly. Okay. So detailed scan usually detailed scan takes about half an hour to do, to measure all the measured all the landmarks, all the bones, and usually done for high risk mothers, those who have previous abnormal babies, or those who have some medical problem, taking certain medication which may cause abnormality and things like that, or previous death, previous baby death inside the uterus, which we don't know why. Okay, things like this, we will offer them a detailed scan to look for any abnormalities or any problems. So this is basically a rough chart which we use. Once 12 weeks, the uterus, you can feel the uterus already. Once 12 weeks, you can feel, that means the uterus become an abdominal organ. From a pelvic organ, become abdominal organ. And uterus is at the umbilicus at 20 weeks. If the uterus size at the umbilicus and like that, we follow that. We have a guide. Okay, so this is what we check the abdomen to see what is the size of the uterus, whether it's corresponding to dates. So now I come to one of the commonest cause of medical problem in pregnancy, which is diabetes. Okay. Diabetes, usually those who, mothers at risk, there's a long list of at-risk cases. Those mothers at risk are screened. Okay, they are screened for diabetes. So at the booking, we take the family history. If there's any family history of diabetes, or if the weight is, mother's weight is more than 80 kg, or if the age is more than 35, or if there's any previous big baby, say baby more than 3.5, 4 kg, delivered big baby, or any problem during the delivery, say like shoulder dystocia, anything like that, or previous miscarriages, baby dead in the uterus, or abnormal baby, all these are risk factors we screen for diabetes. And during the pregnancy also, if there is excessive weight gain, or when we scan, we find too much amniotic fluid, the fluid inside is too much, but the baby is normal, we don't know, we don't see any other cause causing the fluid to be excessive, or if the baby is bigger than the dates, or sugar detected during urine test, we will screen. Okay, we will do a MGTT. This is maternal oral glucose tolerance test. Okay, the favorite drink serve in the clinic kesihatan. Okay, why this test is done? First thing is overnight fasting. Okay, you have to fast overnight, and in the morning, first thing is what they do is they will take the fasting blood sugar. Okay, and after that they give you this glucose solution. Okay, to drink this on empty stomach, very sweet drink sometimes can be a bit difficult, but you have to take this in, and after 2 hours, after that you don't take anything. After 2 hours, blood is taken again to check the level. So fasting, if it is more than 5.1 or 2 hours more than 7.8, it is called gestational diabetes mellitus. Okay, it is called gestational diabetes mellitus. That means diabetes during pregnancy. Okay, so if your level is deranged, next thing is you'll be advised to do a blood sugar profile. That means the blood is checked. No? Blood using the blood is checked. Okay, blood is finger prick. From the finger prick, blood is checked using the glucometer. Check between 4 to 7 times. That depends on how bad the diabetes is, and then it is done either fasting. It is done fasting, and then either pre or post meals. Okay, and you also sent to the dietitian for counseling to teach you how to what type of food to take, what kind of how many calories and things like that. And if the results are deranged, you may need medication to control the blood sugar. But basically, my advice is most important is diet control. Okay, if you don't control your diet, then the blood sugar won't be controlled, and this you will need more medication or more insulin to control it. All these are done to prevent complications, because diabetes, if it's not controlled, can cause a lot of complications. The worst we have seen is death of the baby inside the uterus. So this is a typical BSP. Okay, this one you can see it is taken 4 times. Okay, the next commonest medical problem is high blood pressure. So at every visit, we measure the blood pressure. Okay, so once the BP is more than 140/90 during pregnancy, you will be closely monitored. Okay, if there are few readings and the BP keeps going up, and you have also certain signs like excessive weight gain, when there's excessive leg swelling, or when you pass urine, there is some protein in the urine, and we check the urine, then things like this we will be more careful, and we will start medication. Okay, antihypertensive medication is started to reduce the blood pressure. Okay, what we are worried of is something called preeclampsia. Preeclampsia means it is a severe form of high blood pressure. So in those women who have preeclampsia, the blood pressure not controlled, they will start having headaches, they'll have vomiting, and then this is because irritation of the brain, blurring of vision, then heartburn. Okay, epigastric pain, heartburn. They'll have severe heartburn. The leg swelling will be excessive. Sometimes the abdomen, lower abdomen also there'll be swelling. Okay, all because of retention of water. All this very worrying. Okay, and the uterus is usually smaller than the dates, and the baby growth also smaller. These are all already called preeclampsia. And if it's still not controlled, if the woman starts fitting, that is a is known as eclampsia, and it is a obstetric emergency. And once the lady feeds, the only treatment is to deliver the baby. No matter how big, how small, how big, need to urgent delivery. We start medication to control the blood pressure, and we have to deliver. So be careful with blood pressure. Anemia is another common thing. Low hemoglobin. There are many causes. A lot of women are anemic. Sometimes because before pregnancy they have heavy menses, not enough taking, not proper dietary supplement to to um, to increase the hemoglobin level. So they are sometimes they're anemic, or sometimes during pregnancy they don't take enough supplements, or because of the dilution factor. Okay, the blood, the plasma, the water part of the component is more than the cell part, so there'll be some anemia. The hemoglobin looks like going low. So, and then also thalassemia is another common problem. Okay, a lot of women when they're pregnant only they find out they have thalassemia. So that is okay, another cause of anemia. So if the hemoglobin is low, we supplement with iron. Okay, there are many forms of iron. There are tablets, and if it's low, we injectables. If it's like excessively low, then symptoms are very bad. We may need to transfuse blood. Okay, so anemia, some of the symptoms of anemia is you feel lethargy, you feel tired, baby growth will be affected, and then there'll be another thing what we are worried is after you deliver, there'll be excessive bleeding. Okay, so to prevent all this, please take your iron supplements and please check your hemoglobin level. Vaginal discharge, another common problem. This is due to hormonal changes during pregnancy. Okay, the commonest commonest organism is Candida yeast infection. Usually it is like curdy white discharge, and it may cause discomfort. Sometimes it cause itchiness. We have medication. We give medication for it. And, but if the discharge is yellowish or foul smelling, cause very much itchiness, then we have to take a vaginal swab. Okay, we have to find out what organism. What we are worried about the most notorious is the GBS, group B, notorious GBS, group B streptococcus. Okay, this fella can cause a lot of problems. Sometimes can keep quiet, can cause a lot of problems. So if we detect this, we may need to treat first, okay, to prevent further complications. So if you have discharge which is like abnormal, please see your doctor, please inform to find out further. Okay, so this is what the candida looks like. It is very curdy. It comes in, it like clumps. And swab is we take this, we insert into the vagina, and this specimen is put in and it's sent for culture. Usually culture takes about 3 days to find out. Then bowel problems are very common in pregnancy. Feeling bloated, constipation. This is due to slow bowel movement during pregnancy. This is due to the hormonal progesterone. They can cause during pregnancy. You need all the nutrients, so the bowel moves slow, and this may cause piles, hemorrhoids. So to prevent this, take adequate amount of fluids, take a lot of fiber, cereals, all this will help passing motion. Okay. Now we come to third trimester, from 28 weeks to delivery. So during third trimester, what we do is we continue the monitoring of the baby growth, and okay, during this time we encourage you to keep a baby kick chart. The red book usually has a chart, but then you have to at least monitor your baby kick chart. Bleeding after 20 weeks, late second trimester, third trimester, this is called antepartum hemorrhage. Okay. The commonest causes of bleeding is because if there's placenta previa or abruptio. Otherwise, more common is if there's any inflammation of the cervix. Okay, because of the vaginal discharge, sometimes the cervix, the area become raw and there will be some bleeding. But whatever it is, any bleeding during this time, we have to find out what is the reason. So first thing is placenta previa. Okay, placenta previa, the bleeding is usually painless, The placenta is located at the opening of the uterus. Okay, the part where the baby is supposed to come out. It is located down. So there are 4 types. Okay, type 1, sometimes type 1 just covers a little bit, just part of it only. Type 2, it comes to the opening. Type 3, it covers the opening partially, nearly fully covers. Type 4 is fully covers. Okay, this is very, very dangerous. This one can bleed anytime, and if it bleeds, sometimes it's very profuse bleeding. So that is the importance of locating the placenta during second trimester. So the features of placenta previa is usually the bleeding is without pain. So treatment depends on the severity of the bleeding. Usually a lot of centers, once the lady is about 32 to 34 weeks, they ask them to stay in the hospital, rest in the hospital until delivery. And this one, there's no other way but cesarean delivery. Okay, this is the diagram. This looks like a placenta type 3. Okay, this is where you deliver type 2 to 3. This is the baby. This you can see the baby here. And this is the placenta. Okay. Another thing is abruptio placenta. Abruptio means when the placenta detaches itself from the uterus. Okay, this will have bleeding and will have pain. The causes sometimes infection. Okay, vaginal infection which goes up into the uterus can cause the placenta to detach, high blood pressure, or trauma at the abdomen. If there's any fall, any accident, directly kena the abdomen can cause this kind of thing. So that's why when there's any fall, anything, first thing is we will check the abdomen, see whether it is soft or not, and then we'll scan to see the placenta. Okay. And if there's abruptio, if we think there's abruptio, usually very pain, and then the uterus is very tight, very contracted, very hard. This kind of thing, we cannot wait. We need to deliver urgently. Okay, as you can see, just the placenta, the separation of the placenta. Okay, this is called abruptio. Sometimes placenta previa also can cause abruptio, but this one thing good is the bleeding we can see. This kind of thing, the bleeding is very hard to see. Just a little bit sometimes. So now some general advice. First thing is, once you are pregnant, once you miss period, once you see 2 lines, come for early booking. Okay, and follow up as planned. Come for early booking means because earlier scan is the best, the most accurate, and we can see if there's any complication, anything we can manage earlier. Okay, or if you have any problem, any medical problem, anything, we can start treatment earlier. So come early. Don't wait until like 5 months, 6 months. Please come earlier. And then follow up as planned. Okay, because if there's no problems, it's okay. We will give a longer date to see. But if there's any complication, we have to see. So we schedule the visits. Then second thing is eat adequate, not excessive eating, and have healthy diet. Okay, eat healthy diet, fresh vegetable, fresh fruit, whole grains, fiber, and also calcium-rich foods, lean meat. If you are diabetic, then you have to reduce all the sugars. Carbo you must reduce. Okay, you can supplement with more of fruit, vegetables, grains, and also meat. If you are vegetarian, please tell us, because vegetarians, I see a lot of vegetarians, they tend to be a bit anemic, so we have to advise them to adjust the diet. Food should be adequately clean and cooked. Okay, this is to prevent food poisoning, viral infection. Take adequate fluids, hydrate yourself well. Now our weather is hot. Okay, during pregnancy you breathe also more, breathe deeper, breathe faster. You lose water from there also, so you need to take enough fluids. Exercise, regular exercise. Okay, just some brisk walking, be a bit fit. No extreme sports, don't go for marathons and all that, please. So um, do regular exercise at home. Avoid heavy weight, heavy lifting, heavy weight, or standing long hours. This is basically to prevent varicose veins. Okay, rest is very important. Get good rest, get good sleep, especially at night, at least 8 hours of sleep. If you need to, especially advanced pregnancy, you will need extra pillows. You need to put under your legs, or if you get those heartburn and all that, you need to use 2 or 3 pillows to prop up, okay, or to be in the right position. So once pregnant, get some extra pillows. Don't wear tight clothes, loose fitting, comfortable clothes, okay. And also your footwear, please wear low heel or flat foot. Sexual intercourse allowed unless there's bleeding or any contraindicated. But this one you ask the doctor first. Okay, don't be shy. We will advise you. But so like placenta things like placenta previa, we advise them not to have any sexual intercourse. Then important general hygiene. Keep yourself clean, daily shower, and when you shower, wash the genital area, axilla, okay, the armpits, the breast, all this area, usually there'll be sweating, there'll be increased discharge, so all this may cause discomfort. Keep it dry also. After cleaning, keep it dry, keep this area dry. Vaginal douching is not advised unless the doctor. Dental hygiene important. Take care of your teeth. Okay, if you have any tooth problem, please see the dentist. Okay, that is the do's, don'ts. No smoking, no recreational drugs. Alcohol depends, maybe 1 unit per week, or if possible, stop alcohol. Beware of over-the-counter medication. There'll be 101 people will come and tell you 100,000 things. Okay, there'll be a lot of advice. So please be careful. They'll tell you to do this, they will do that, take this, take that. If you're not sure, you can ask the doctor, you can ask us, we will advise you. But over-the-counter medication, please be careful. If you're not sure, you can ask us, we can advise you whether it is safe or not. Prevent contact with all these industrial chemicals, especially those working in the factories and all that. Careful, chemicals. Okay, these chemicals can have very harmful vapor. Another thing is cat handling. Cat handling, cat litter, especially the cat poo. Careful. There's something called toxoplasmosis. It is very, very notorious. This virus can cause the baby to be abnormal, can cause the baby to go blind, affect the brain, a lot of things. Okay. So be very careful when you're handling cat litter, and also raw meat. That's why we tell you to make sure the food is cooked well, especially meat. And those working in hospitals or in places where there's radiation, please try to avoid radiation. Okay, briefly, I'll tell you about symptoms of labor, because I have another part 2, which is labor, managing of labor and labor pain, which I will arrange a session later. Okay, so once you reach 37 weeks above, okay, we have a list of things for you to bring also to stand by. Anytime you can go into labor. Okay, so labor, first thing is something called show. Show is mucus mixed with blood, some brownish, reddish, like mucus kind of things you will pass. Or sometimes the water bag will burst. Okay, it is like sudden gush of fluid. But a lot of women commonly they'll come with this. Actually, it's just urine. Okay, so if you have this, come and see, come and check. Okay, sometimes the water bag will burst. Then and also labor pains. You will have starting pain which is starting from the on top, the fundus, the top part. Backache is very common. The backache is all called false labor pain. This is when you start having pain and you're having regular. The pain will start increasing, and the frequency also start increasing. This is already going into active labor. This is the time you should come and see us. We will do a vaginal examination and see whether you're in active phase or not. Okay, so in summary, antenatal care is very important, basically for important outcome for a healthy baby and healthy mother. It helps detect risk and for early intervention. Follow doctor's advice. Ask doctor if you have any doubts during follow-up. And it's important to practice a healthy lifestyle. So when you follow up with me, I usually routinely do a 5D scan during follow-up. If you can see properly, you can see sometimes it's all luck, depends on position of the baby. This one you can see the various weeks from 6 weeks to 36 weeks. Okay. So if you, for further information, you can call this number or extension, or you can use the Bagan app for an appointment, or you can go into my Facebook page. Okay, you can WhatsApp me directly. Okay, please like. Thank you very much, and have a good evening. Thank you very much for listening. Good night.
We got one question from Lina Oi. She asked about when are we supposed to feel the baby movement? Is it 18 weeks onwards?
Okay, there is one question regarding there's one question from Madam Lina Oi. She asked, when are we supposed to feel baby movement? Is it from 18 weeks onwards? Okay, baby movement, usually those mothers, the first pregnancy, usually expect to feel from 20 weeks onwards. 20 weeks, that means 5 months onwards. But some ladies, those who are like a bit obese or thick abdominal wall, sometimes they might not feel at 20 weeks. They will feel later. Okay, sometimes 22 weeks, 24 weeks or so. But sometimes they are worried, but when we do the scan, we can show them the baby's heartbeat and can show the baby kicking all, they'll be happy. But those ladies who have previous pregnancies, you know, those who are experienced mother, we call, those who had 2-3 pregnancies before, sometimes by 18 weeks or so, they can feel. Okay, so even if you cannot feel at 18 weeks, don't worry. Okay, you just wait for another 2 weeks. Usually 20 weeks above is the time where you feel the baby movement. So I hope I have answered your question. Any other questions? That's all, huh? Okay, so thank you very much and good night.
Thank you, Doctor, for the sharing. So with that, ended our live session for today. Thank you all for joining the live session and have a good night. Thank you.